But I want to show you the top voted question on YouTube that was submitted on health care, and it comes from Ian McDonald of Michigan, who says he has a health problem. Watch it, sir.
Hi, I'm a student and I have a chronic heart condition. So for me, and those like me, the Democrats' health care reform, allowing us to stay on our parents' insurance longer, was a godsend. If you were elected, would you work, as is the stated position of your party, to repeal this reform? And if so, are we supposed to just sign up for 12 credit hours and pray really hard that our ailments don't prevent us from going to class?
Governor, what about provisions that Ian talks about, for instance, the one that allows kids to stay on their parents' policies until they're 26, or not limiting coverage for pre-existing conditions? President Obama says the only way that insurance companies can afford to provide those kinds of reforms is with the individual mandate, where they get a lot of new customers.
When I hear this discussion, I think of my daughter Elizabeth, who's sitting on the front row, who suffers from juvenile diabetes. And I also am reminded that we're fundamentally approaching health care reform the wrong way. This $1 trillion bomb that Obamacare means to this country over 10 years is creating such uncertainty in the marketplace that businesses aren't willing to hire, they're not willing to deploy capital into the marketplace. It has gummed up our system. So you say, what do? I say we go out to the states and let the states experiment and find breakthroughs in how we address health care reform. Health care reform, it's a $3 trillion industry. It's the size of the GDP of France. It's large, it's complicated. All I want to do is do the kind of thing we did in the state of Utah in direct response. We need affordable insurance policies. We don't have affordable insurance policies today. We got one in the state of Utah, a stripped-down, bare-bones, catastrophic coverage policy that young people could finally afford. And then you can start whittling down the high percentage of the people who are uninsured in this country because they have an affordable policy. That's number one. Number two, we have to deal with cost containment measures like harmonizing medical records. We were the first state to do that. So let's forget about federal fixes and solutions and turn to the states where we're going to find real breakthroughs and real answers to this terribly difficult and complicated problem.
Thank you. Thank you, Governor. Congresswoman Bachmann, in the last debate, you criticized Governor Perry for his executive order mandating that sixth graders get the HPV vaccine to prevent cervical cancer. Then afterwards, you suggested that the vaccine was linked to mental retardation, and you said that it could, quote, potentially be a very dangerous drug. But the American Academy of Pediatrics has looked at it and says that the HPV vaccine has an excellent safety record. So my question to you is, do you stand by your statement that the HPV vaccine is potentially dangerous? And if not, should you be more careful when you're talking about a public health issue?
Well, first, I didn't make that claim, nor did I make that statement. Immediately after the debate, a mother came up to me, and she was visibly shaken and heartbroken because of what her daughter had gone through. And so I only related what her story was. But here's the real issue. Governor Perry mandated a health care decision on all 12-year-old little girls in the state of Texas. And by that mandate, those girls had to have a shot for a sexually transmitted disease. That is not appropriate to be a decision that a governor makes. It's appropriate that parents make that decision in consultation with their doctor. But here's the even more important point, because Governor Perry made a decision where he gave parental rights to a big drug company. That big drug company gave him campaign contributions and hired his former chief of staff to lobby him to benefit the big drug company. That's what was wrong with that picture.
Governor Perry, obviously 30 seconds to respond, sir.
Thank you. I got lobbied on this issue. I got lobbied by a 31-year-old young lady who had stage 4 cervical cancer. I spent a lot of time with her. She came by my office. She talked to me about this program. I've readily admitted that we should have had an opt-in in this program, but I don't know what part of opt-out most parents don't get. And the fact is, I erred on the side of life, and I will always err on the side of life as a governor and as the President of the United States.
Governor Perry, I now have a question for you. Texas has the most uninsured residents of any state in the country, 25%. In the last debate, you blamed it on restrictions imposed by the federal government, but we checked about that, sir. In fact, the feds treat Texas like they do all the other big states. On its own, Texas has imposed some of the toughest eligibility rules for Medicaid of any state in the country. In fact, you rank 49th in Medicaid coverage of low-income residents. So the question is, isn't Texas's uninsured problem because of decisions made by Texas?
Well, I disagree with your analysis there, because we've had a request in for the federal government so that we could have a Medicaid waiver for years. And the federal government has stopped us from having that Medicaid waiver, allowing the state of Texas, or for that matter, the other states that we're making reference to here, to have waivers, give them more options to be able to give the options. There's a menu of options that we could have, just like John Huntsman talked about. That is how we go forward with our health care. Each state deciding how they're going to deliver that health care. Not one size fits all. And I think this whole concept of not allowing the states to come up with the best ideas about how to deliver health care in their state. And the fact is, people continue to move to the state of Texas, some of the highest rates in the country, because we have created a state where opportunity is very much the word of the day there, if you will, for finding work and what have you. And our health care is part of that, our education is part of that, and we're proud of what we put together in the state of Texas.
Governor Romney, the other day, Governor Perry called Romney Care socialized medicine. He said it has failed in Western Europe and in Massachusetts, and he warns that Republicans should not nominate, his words, Obama light. How do you respond to Governor Perry?
I don't think he knows what he's talking about in that regard. But let me tell you this about our system in Massachusetts. 92% of our people were insured before we put our plan in place. Nothing's changed for them. The system is the same. They have private market-based insurance. We had 8% of our people that weren't insured. And so what we did is we said, let's find a way to get them insurance. Again, market-based, private insurance. We didn't come up with some new government insurance plan. Our plan in Massachusetts has some good parts, some bad parts, some things I'd change, some things I like about it. It's different than Obamacare. And what you heard from Herman Cain is one absolutely key point, which is Obamacare intends to put someone between you and your physician. It must be repealed. And if I'm President of the United States, on my first day in office, I will issue an executive order which directs the Secretary of Health and Human Services to provide a waiver from Obamacare to all 50 states. That law is bad. It's unconstitutional. It shall not stand.
Governor Perry, 30 seconds to respond.
I think Americans just don't know sometimes which Mitt Romney they're dealing with. Is it the Mitt Romney that was on the side of against the Second Amendment before he was for the Second Amendment? Was before he was before these social programs from the standpoint of he was for standing up for Roe versus Wade before he was against Roe versus Wade? He was for race to the top. He's for Obamacare, and now he's against it. I mean, we'll wait until tomorrow and see which Mitt Romney we're really talking to tonight.
Governor Romney?
I'll use the same term again. Nice try. Governor, I wrote a book 2 years ago, and I laid out in that book what my views are on a wide range of issues. I'm a conservative businessman. I haven't spent my life in politics. I spent my life in business. I know how jobs come, how jobs go. My positions are laid out in that book. I stand by them. Governor Perry, you wrote a book 6 months ago. You're already retreating from the positions that were in that book.
Not an inch, sir.
Yeah, well, in that book, it says that Social Security was forced upon the American people. It says that by any measure, Social Security is a failure, not to 75 million people. And you also said that Social Security should be returned to the states. Now, those are the positions in your book, and simply, in my view, I'm going to stand by my positions. I'm proud of them. There are a lot of reasons not to elect me. A lot of reasons not to elect other people on the stage.
But one reason to elect me is that I know what I stand for, I've written it down, words have meaning, and I have the experience to get this country going again.
Gentlemen, thank you both. Brett?
Coming up, we return to issue number 1, jobs. Stay tuned.